my name is Jessica Klingensmith, and this is our marketing video. So first I'm going to go through and I'm going to show you my binders. So this first one's my research binder. Let's see, put it over here so you can actually see it. Okay, so here I have articles, new vitalistic system, and then I have the bad medicine article, and current mechanic systems, and functional neurology and chiropractic, chiropractic spinal, subluxation condition-based care, wellness development care, and vertebral subluxation. So then in my other binder, this is my practice management binder. I have all the tabs here of progress report and all the paperwork, and I have report of findings, circle things, and I have a healthcare class, all the paperwork that goes with that, and then everything needed for the first visit to introduce the patient to the office and the first exam. And I have all of the pre-visit paperwork. So there we have it, the binders. Okay, so for my first visit here, my name is Jessica Klingensmith. What's your name?
Mercedes.
Mercedes, nice to meet you. So we're going to be going through and we're going to be talking today a little bit about chiropractic, what you can kind of expect during an appointment, and today as well as in the future, some things about billing and payment, just kind of how the office runs. We're going to go through the paperwork that you filled out for me when you first got here, evaluate x-rays, and just kind of go through it all. Does that sound fair?
Yeah.
Okay, so why are you here to see me today?
Well, my first complaint is I've been having some neck pain, like in the middle of my neck. It's kind of like radiating down, so that's been kind of bothering me. And then for the past week, I've been having this weird finger pain. I'm not really sure how it started or what happened, so I don't know if you can help with both of those problems.
Yeah, we'll take a look and see what we can do. So what we do today on the first visit, we go through your history, kind of let me know what's going on with you, your general health status. We're going to complete a consultation, just kind of go through everything that we talked about, and then perform an examination, maybe some tests, and I recommend doing x-rays. It just lets me see what's going on underneath the skin and just lets us get a really good picture about what we can do. So the new patient forms you already filled out, medical history, current complaints. I had you fill out some consent forms that consent to care, as well as a HIPAA patient privacy information, just letting you know that everything we talk about is going to be held strictly confidential. I'm not going to share the information with anybody. So we're going to go over that together here and then move forward with the physical exam like I talked about. And then we'll go through with the chiropractic exam. I'm going to take a look at your neck, your back, the rest of your spine, your hand and your finger there, do some ranges of motion, just kind of see what we can do, figure out what's going on with you. So then today, just so you know, is going to be the longest visit. We'll spend probably 45 minutes, maybe an hour. I just want to be really thorough, get a good history on you, get to know you and what's going on with you, and just kind of get a big picture of how things are going. Does that sound okay?
Yeah.
Okay, so then after that, normally visits will be 15, 20 minutes at the most. We'll do the best we can to get you in and out. I know your time is valuable, so I don't want to keep you waiting around for very long. Also, so that goes over basically what I have in store for today. Does that sound okay? Do you have any questions for me?
So what exactly, when you are I have never been adjusted by a chiropractor, so do you work on all areas of the spine, or how exactly are you going to help me?
Yes, so I will be looking at your whole spine, the way your body functions, the way you move, the way you walk, taking all of that into consideration. So,
okay.
Yeah. Okay. So then let me just go over our office policies with you. I just kind of want to let you know how things run, what you can expect when you come in to see me. I do ask that you call ahead to make an appointment. You know, we might not be able to get you in that second, but if we can try to get you in that day, if you need to come in, we'll move stuff around, see what we can do. And then that way it just guarantees you a spot to come in and see us. Also, if you need to cancel, please just call. That's all that we ask. There's no penalty for cancellation. We would just like to know so that maybe we can squeeze somebody else in and we can just keep everything running smoothly.
Yep.
All right. And then we ask that you please silence your phone while you're in the office. Just lets me take better care of you and focus on what's going on with us. Is that all right?
Yeah.
Good. And then I do ask that you give payment at the time of service. That way we just don't run into any issues with billing or insurance companies, and we can just take care of things as they come. Mm-hmm. Also, I do offer a new patient orientation classes Monday nights at 7 o'clock, and I would love for you to attend. Bring your friends, your family, whoever you hold near and dear to you. It's completely free. It's about an hour long. It just kind of educates you on what chiropractic really is, and since you're a new patient, this would be a great thing for you. And just lets you ask any questions, and we'll have some dinner and some appetizers served, and we'll just kind of go through the whole thing. I just want you to be really informed.
Okay.
Do you have any questions at this time?
When I come in for like any adjustment, is it okay to like bring my significant other so that they can kind of see what's going on and maybe they would be interested in coming too?
Yeah, absolutely.
Okay.
Absolutely. We would love to have them.
Okay.
All right, so then next I just kind of want to talk about the financial side of things, just so that everything's on the table, you know exactly what's going on. So we do take insurance. You can deal with, whatever your insurance plan is and pay with that. You can pay in advance, so whether that be monthly, whether that be weekly, whether that be for, half of the year, that's entirely up to you. Then you can also pay per visit. So just whatever works best for your needs.
Okay. All
right, and then today our consultation will be free. So we'll go through, we'll talk, we'll develop a plan, and then from there you can decide if you want to proceed with care. Okay. So after this, I do perform x-rays, and that's about $150, just so you know.
Okay.
But that just gives us a really clear picture on what's going on and lets us really know how to best give you care. So after that, visits are $40 a visit. And do you have any comments, questions?
So today I would only be paying $150 for the x-rays, correct? And then therefore I would just pay $40 per visit or pay ahead, like you said. Okay.
Exactly.
Yeah,
yes.
I understand.
And we do have some packages too that we can talk about once we get you out to the front desk if you're interested in that option.
Yeah.
All right. So then I have your paperwork here. Let me go ahead and we can go through that together because I just want to make sure I have everything correct and I'm understanding what you wrote down.
Yeah.
All right. So Mercedes, your birthday is September 2nd of 1991, which makes you 24 years old. You are a full-time student. Do you have, and it says here, no known allergies. You smoke never. Drink alcohol occasionally. You don't take any medications. All right. And then family history. It looks like you have a grandmother with bipolar disorder and a grandfather with cardiovascular disease.
Yes.
Okay. You are single, not married. Okay. You've never had any vaccines.
No.
Good. Your eating habits you rate at a 7 out of 10, which is pretty good. Physically active 3 to 4 times a week. Good. You've never had any significant injuries. The only surgery you've had was when you were 2 years old and it was eye surgery.
Yes.
Do you have any problems with that now?
No.
Okay, good.
I occasionally just wear reading glasses, but that's about it.
Okay, good. You've never been in a car accident?
No.
All right. So then today you've got some neck pain. Can you tell me about that neck pain? Here it says that it's a little bit radiating. It goes down. Can you kind of show me?
Yeah, it just kind of starts at the top of my neck and then like radiates down to the bottom here.
Okay. What does that pain feel like? It says a dull pain?
Yeah, it's
aching?
just like kind of dull and like I said, about a 6 out of 10.
Okay.
I mean, it's not always 6 out of 10, but like at its worst, I guess I would say.
Okay.
6.
So it's better when you lie down or eye sit?
Yeah.
Okay. And then it's worse when you're at school, looking down, staring at your computer?
Yeah.
Understandable. All right, and then let's talk about this finger. So it's your third digit, and you kind of circled the area right about here. So is that where you're experiencing the pain?
Yeah.
Okay.
Right here.
All right. And there was no trauma?
No, I mean, I don't recall, like, doing anything at the gym or doing anything specifically. Like, I just started hurting kind of out of nowhere, so I'm not really sure what caused it. But it's just, I mean, when I'm not moving, it's fine. And then when I am like moving it around, it just has kind of like a sharp pain in there, so I'm not sure.
Okay.
What
And is that your
happened.
dominant hand?
No.
Non-dominant
Yeah,
hand.
non-dominant.
Okay. All right, and you rated that pain as a 4 out of 10. It's kind of stabbing?
Yeah.
Okay. All right, and worse when moving, better with rest. Okay, just like you said. So then I would go through, take some x-rays, and then on our review of findings exam, we would talk about your x-rays. So with those x-rays, I would obviously show you, go through that, and upon review, it looks like you're in pretty good health, and I would like to work on that neck pain there. What I can see here is that there was a little bit of a subluxation, which just means that, let me show you, that the bones have moved out of place. So these are all the bones in your neck, and then these represent nerves. So sometimes through actions or different things, it can cause a bone to move, and then one of these little nerves can get pinched, which therefore causes pain. So I believe that's what's causing your pain today. And we can go through and take care of that and hopefully try to alleviate all of that. Also, your hand x-ray looks pretty normal, so we'll go through and work on some tests and develop a plan for that as well. So I really feel like you would benefit from some chiropractic care, but I just want to make sure you know that with chiropractic, like many things in life, it's not necessarily a one visit end all be all. So I want you to know that your body takes time to adapt to moving those bones back in the correct place, because there's no knowing how long they've been maybe out of place, and your body has adapted to them being out of place. So we'll put them back into place. Your bones may not always hold. So I recommend coming in once a week for the next 6 weeks so that we can evaluate you and see where you're at, okay? All right. And so that consistent care and checking of your spine is just going to be really important to the progress and letting you feel the best that you can. So at that time, after that 6 weeks, I'd like to reevaluate, see where you're at, and we can go from there. Does that sound like an okay plan to you?
Yeah.
Okay.
So is the reason for like needing to come once a week just to like make sure that the adjustment worked, or like what exactly does that mean?
Yeah, I just want to make sure that the bones are in place, that they are not pinching anything, that you are benefiting from care, so that your spine is in perfect alignment.
Yeah.
Okay. Great. So with that, any other questions?
I did have one question, kind of back to like the financial thing. Do you guys in your office do any kind of like family package where like if you have more than one family member, like you give a discount, or like do you guys do anything like that here?
Yeah, we do. We do a family package if you kind of buy a chunk so that you're going to pay for maybe, like the next 3 months. We'll do a discounted rate for families. Absolutely.
Okay. Perfect. I don't think I have any more questions. I'm really interested to start care, so
Great. Okay, let's begin.
okay.